Immunology, lymphatic drainage. All right, so lymphatic drainage, as we know, we've seen through the previous, pretty much all the organ systems, the high yield things that you need to know. But I think it's important to just kind of go overview on where certain areas drain. So let's start off with the deep cervical lymph node cluster. Deep cervical lymph node cluster is going to have malignancies of the head and neck and oropharynx, okay? So anything in that upper area, if you have a malignancy there, it's going to go to the deep cervical lymph nodes. Now, supraclavicular is going to be the malignancies of the thorax and abdomen and pelvis, okay? So there's two separations, right? So from the neck down is going to be all the malignancies are going to go to the supraclavicular nodes. From the neck up, all those malignancies will go to the deep cervical nodes, okay? So that's the first thing that you should really take into account. Next is going to be TB, sarcoidosis, lung cancer, and granulomatous disease. This is going to be the mediastinal and hilar lymph nodes. We know this process, right? We already discussed it in each of their respective organ systems. So just remember, mediastinal and hilar lymph nodes are what we're going to be expecting for pulmonary TB, sarcoidosis, lung cancer, and granulomatous diseases. Next is going to be mastitis or metastasis, especially in breast cancer, is going to be to the axillary nodes. We know that. Syphilis could be epitrochlear. That's going to be syphilis. Not very high yield, but it's something that they could ask about. And then moving forward, we could have the gastric cancer, which could present in the periumbilical region, which is the Sister Mary Joseph nodule or lymph node. And then for periaortic is going to be testes, ovaries. Remember that the pair of testes, a pair of ovaries, that's where it's usually going to be draining into for the periaortics. The external iliac is going to be the body of the uterus, the cervix, and those are the two high yield things which we already discussed in the repro section. The internal iliac is going to be the cervix, the proximal vagina are the two high yield things, as well as the prostate. And lastly, we have the superficial inguinal. Superficial inguinal is going to be the distal vagina and the vulva, as well as the scrotum, okay? Those are the high yield associations. Remember, we already discussed this in repro, so if you need a refresher, go to the repro chapter to listen about the lymphatic drainage. All right, so this is our lymphatic drainage associations, and then we're just going to be discussing next kind of the organ systems involved in immunology.